everyone, and welcome to the University of Michigan Sound Support Parent Webinar Summer Series.
My name is Emma Brooks, and I am the Sound Support Coordinator for the University of Michigan's Hearing Rehabilitation Center. I hope you all are off to a great start to your summer. As many of you are aware, Sound Support is an outreach grant funded by the University of Michigan Department of Otolaryngology and Michigan Medicaid. The grant is designed to provide outreach and support to children with hearing loss throughout Michigan. We've put together this series of webinars for parents due to the great responses from the past few years' series. We hope you'll find them to be helpful, and we encourage you to share topic ideas for future discussions with us on our evaluation, which will be sent at the conclusion of our three-part series. We strongly encourage your feedback and suggestions. You will find presentation slides located on the Handouts tab located on the toolbar. You are able to download these or print them directly from your computer or device. There is also a Questions tab. Please feel free to ask questions throughout the presentation, and we will address as many of them as we can at the end of the presentation. If you are watching a recorded version of this webinar, feel free to send your questions to me at oto-soundsupportci@med.umich.edu. Today, our webinar is titled Auditory Neuropathy. I would like to take the opportunity today to introduce our presenters, Kelly Starr and Dr. Caroline Arnett. Kelly Nichols Starr is a speech-language pathologist and a certified auditory verbal therapist and listening and spoken language specialist at the University of Michigan's Cochlear Implant program. Kelly received her bachelor's degree from Michigan State University and completed her master's in speech-language pathology at Wayne State University. She has presented nationally on various topics related to pediatric hearing loss and development of listening and spoken language. Kelly is part of U of M's Sound Support Outreach Grant, supported by the State of Michigan and the University of Michigan Department of Otolaryngology, providing outreach and lectures to educational professionals and students in the state of Michigan. Caroline Arnett is a cochlear implant audiologist at the University of Michigan in Ann Arbor. She has worked with pediatric and adult cochlear implant patients for over 10 years. She coordinates a multi-site longitudinal clinical research study looking at factors affecting performance of pediatric cochlear implant patients. She has previously served as a research audiology consultant for Kresge Hearing Research Institute at the University of Michigan Medical School. She has presented nationally on various topics related to cochlear implants, pediatric audiology, and auditory neuropathy. I'll go ahead and hand it over, and we will get things started.
Thank you, Emma. And I want to thank all of you for joining us today, either live or through the recording of this webinar, for this parent webinar on auditory neuropathy, sponsored by the University of Michigan Sound Support Outreach Grant. So as Emma indicated, today both myself and my colleague Kelly Starr are going to be providing a basic introduction to auditory neuropathy. Our goal today is to help you build a solid foundation in the basics of this condition so that you have a better understanding of auditory neuropathy, and as well, you can better explain this complicated and often confusing condition to friends and relatives. So let's start by orienting ourselves to how we hear and how the auditory system works. So sound is picked up by our outer ear, travels along our ear canal, causes our eardrum to move back and forth, which then causes these little bones in our middle ear to also move back and forth, which then pushes on our cochlea, moving the fluid in our cochlea and causing those little hair cells in the cochlea to bend, which then sends a signal to the auditory nerve, which then sends a signal up to the brain. Now, in different types of hearing loss, let's say there's an issue kind of in this area, so either in the ear canal or in the middle ear. This type of hearing loss is called a conductive hearing loss. We can't conduct the sound. We can't get it to where it needs to go. Oftentimes, this type of hearing loss is temporary. It can be treated medically. The next most common type of hearing loss happens when there's something wrong in the cochlea. So for some reason, the cochlea, we can get the sound there, the ear canal is clear, The middle ear is clear, but once the sound gets to the cochlea, there's a problem. And this type of hearing loss is called sensory neural hearing loss. The type of hearing loss that we're going to talk about today, auditory neuropathy, there's something that's not working where in the connection between the cochlea and the brain. So somehow in that area, something's going wrong, which is causing a type of hearing loss, which we refer to as auditory neuropathy. So let's look a little bit more in depth into what really is going wrong in auditory neuropathy and why it's so complicated. Auditory neuropathy really challenges the way the field of audiology has traditionally thought about hearing loss. And to be honest, I was originally drawn to audiology because I loved math and science, and the black and white nature of audiology really appealed to me. Individuals could either hear or they couldn't, and an audiologist would determine the degree of hearing loss, prescribe the treatment, and retest to ensure that the treatment works. Now, with auditory neuropathy, it's a condition where we see individuals who have a significant mismatch between what they can hear and their ability to make sense of and understand and use what they've heard. And we've had to rethink a lot of our treatments as well. I have a lot of parents of children with auditory neuropathy who are confused and frustrated as to why, if hearing loss in general has been around since the beginning of time, why does it seem like we haven't really figured out auditory neuropathy yet, and we can't give them a straight answer about their child's hearing loss? So I want to give you a little bit of background on that. One of the reasons for this is, although auditory neuropathy is not a new condition, like people didn't just start having this condition, it's a newly identifiable or a new diagnosis. So back in the 1990s, a test called an otoacoustic emissions test, or an OAE test, became commercially available. And this test was able to isolate and test the function of the cochlea independent from all the other parts of the auditory system. So, as you can see here, a mini probe with an ultra-sensitive microphone is simply placed in the ear and can measure the health of the cochlea. So we were then able to uncover information about the cochlea in isolation. So as this test was used more and more after its development, the field of audiology started to note that some patients who appeared via an auditory brainstem test or an ABR, like many of you are probably very familiar with, the ABR test indicated that an individual could not hear well, but actually then they had an OAE test which told us that they had good cochlear health. And this discrepancy was found again and again. And further investigation led us to understand that the auditory signal, which is highly dependent on the synchronous transmission from the nerve to the brain, was somehow being disrupted, or it was no longer synchronous. And these individuals appeared from this OAE test to have normal functioning cochleas, but when they had the ABR test, they had abnormal neural function. Thus, we have this condition where the individual appears to have a healthy cochlea, but a hearing nerve or an auditory nerve that wasn't firing reliably or not with enough synchrony to get a clear message to the brain. And this is what has become known as auditory neuropathy. Just as a note, there were also several other names that were trials kind of along the way to attempt to better describe this condition, including auditory dysynchrony and auditory synaptic disorder, but auditory neuropathy has really seemed to stick throughout the years. There's been some work done to simulate when an individual with auditory neuropathy actually hears. So I'm going to play one of these simulations now. And what you'll hear is Arnold Starr, who is an individual, a researcher credited with first uncovering this condition. He's going to repeat the same sentence several times with varying degrees of severity, starting with kind of the most severe smeared simulation, and then he's going to end with the sentence completely unaltered. And you can hear this timing just isn't right. There's this significant temporal processing or a timing problem with the sounds, rendering you unable to kind of make out the sentence in the beginning. So I'll go ahead and start that now. That was the wrong button. I went to the next slide. Sorry. Let's try that again.
Time present and time past. Time present and time past. Time present and time past are both contained in time future.
So it's believed that the severity of that distortion you just heard is dependent on exactly where the damage is. So we come back again to this graphic, and in talking about auditory neuropathy, we've localized the damage to this area between the cochlea and the auditory nerve. But within this area, there are several locations for possible damage. And unfortunately, we do not have the needed tests that are extremely specified to determine the exact site of the damage that's causing this auditory neuropathy. So damage can be where the signal leaves the cochlea, or it can be where the signal gets transmitted from the cochlea to the nerve, or it can be where the signal reaches the nerve, or there can be damage with the nerve itself. So individuals with the same diagnosis of auditory neuropathy can have varying areas of damage in their ear. It also makes sense then that the effects of auditory neuropathy on one's hearing can also vary. So here are some hallmarks of kind of auditory neuropathy, again, that can vary per individual, but they can have hearing detection at any level. So if we're behaviorally just testing their hearing in the sound booth, and we're looking to see when they first respond to sound, those behavioral measures can reveal normal hearing all the way up to a profound hearing loss. That hearing can also fluctuate. So parents will say that their child seems to have good hearing days and bad hearing days. Their understanding of speech is going to be poorer than we would expect. So often we'll see kind of a discrepancy between someone having kind of a mild hearing loss, but responding in similar to what a child with a profound hearing loss would respond as, or at the connected speech level. So they're able to respond to and understand words in isolation, or if you just say a single word like shoes. But if you have words kind of connected together, as we speak, and say, go get me your shoes and bring them over here, and make sure that you also have socks on, that individual can't make out any of that because it all smears together like in that simulation. And it makes sense also because of that timing discrepancy that there's also, these individuals have increased difficulty in background noise, where they have a lot more difficulty understanding. So the damage in auditory neuropathy can vary. The hearing symptoms can vary, and as well, the reason or the cause of the auditory neuropathy can also vary. So auditory neuropathy can arise as a result of genetic factors. So there are certain genetic mutations that have been identified. Very likely not all of them have been identified, but there are several that have been identified that lead to auditory neuropathy. Auditory neuropathy can be due to anatomical abnormalities. I think there's some research out there that suggests that 40% of cases with auditory neuropathy actually have a genetic basis, whereas fewer than that actually are due to an anatomical abnormality. Neuropathic conditions can result in auditory neuropathy. Conditions related to prematurity or immaturity, such as extremely low birth weight, prolonged mechanical ventilation, or issues with jaundice. And there are still patients who have auditory neuropathy, and there is no identifiable cause with the means that we have now to determine that. So as you can kind of see this point that I keep hovering on, and that is that this great variability. So there's great variability as to where the damage is in the inner ear or the nerve. We can't exactly pinpoint where the damage is exactly, and it varies per individual. The reason for the damage also varies. And And this is going to lead then to great variability in the auditory impairment or the symptoms that that individual is going to have. And as well, then there's going to be variability in the treatment outcomes. So in recent years, there's been a movement to classify these individuals that have auditory neuropathy, where we have this kind of present OAEs. So that OAE test told us that they have a healthy cochlea, and we have absent or abnormal ABR testing, that these individuals actually are part of a spectrum disorder. And very likely with future advances in available diagnostic tests, many of these conditions that are kind of put in the same bucket right now will be recognized as individual conditions with treatment recommendations that can be more specified. However, until that time, all possible treatment options should be considered for every individual diagnosed with auditory neuropathy. So hearing aids. Hearing aids are one possible treatment, and prior to 12 months of age, they absolutely should be trialed. However, it's important to remember that one of the hallmarks of auditory neuropathy is this temporal processing impairment. So this kind of inability to process the timing clues of sound. So hearing aids take sounds in the room and they make them louder. And hearing aids, they're improving your sound audibility, or ability to detect sound. They cannot resolve this temporal processing impairment. Cochlear implants are also an option. Following a hearing aid trial with a child who's in regular speech therapy, if a child demonstrates poor progress in speech understanding and auditory language development, they absolutely should be evaluated for a cochlear implant. Cochlear implants do have the ability to improve temporal processing because the electrodes that are implanted within the cochlea can stimulate a synchronous firing of the auditory nerve. And FM systems are highly recommended, either coupled to a hearing aid or an implant, or used independently because they're able to lift up or get that target sound even louder, and it helps with this temporal processing impairment. So patients with auditory neuropathy are better able to process speech in the presence of background noise because we're kind of getting rid of that background noise factor. So to summarize, one of the reasons why auditory neuropathy seems new and seems complicated is because it's newly identifiable, right? So back in the 1990s is when we started to regularly use these audiologic tests that are going to be able to more specifically measure specific auditory functions. And that's where we found out that in some of these cases, we have a cochlea that's going to be able to work, but this neural transmission that is faulty. It's also important to remember that a lot of these cases with auditory neuropathy, a lot of these kids also have comorbid diagnoses. So they have other things that they're working through as well. And so kind of medical complications are going to add to the complexity of the diagnosis of auditory neuropathy, the means of treatment, and the outcomes. So kind of putting all of that together, given auditory neuropathy's kind of newness, combined with all of its variability, there is no gold standard of treatment. And as well, one other thing to think about is that the incidence of auditory neuropathy is likely on the rise due to medical advances that are allowing for increasing survival rates of extremely premature infants. So kind of all of that goes along with being extremely premature puts you at greater risk for developing auditory neuropathy. So as those babies have increasing survival rates, the likelihood that auditory neuropathy is going to be diagnosed more and more is pretty high. As parents, this is very complicated, and I encourage you to give yourself a break. Many of you, the first person you've likely ever met with auditory neuropathy is the person that you love the most in this world, and that's your child. So this is a lot, and our recommendation for parents is always to make as many appointments as you need, and the more appointments, the better, with your audiologist for kind of continuous monitoring of your child's progress, but also for continuous understanding as a parent as to how auditory neuropathy affects your child. When you get a diagnosis of auditory neuropathy, it's going to tell us that that's the condition that your child has. Auditory neuropathy does not tell us where your child is going or how they're going to get there. And because of all of this variability, every child with auditory neuropathy spectrum disorder is going to have their own story, and they're going to need an individualized, consistent treatment plan that will help them write their story. So now I'm going to turn it over to Kelly Starr, who's one of our speech pathologists, who's going to speak more to this individualized management of auditory neuropathy. All right. Thank you, Caroline. So how does speech and language present itself for children with auditory neuropathy? And for the way my mind is wired, auditory neuropathy spectrum disorder helps me remember that auditory neuropathy can present itself on a spectrum and therefore will have different performance outcomes. So for communication and talking, we need to have clear access to all the sounds of speech. Here we have the audiogram, and across the top we have frequencies that go from low to high, like a piano keyboard, and then going from top to bottom we have sounds that go from quiet to loud. So the audiogram shows us that they have detection of sound, and usually this is my go-to for talking about what a child hears in comparison to the sounds of speech, or our speech banana, which is highlighted here in the blue. But when discussing auditory neuropathy, that does not give us the complete picture because the audiogram does not show the information about the timing, and the timing is what's needed for comprehension. The audiogram does show us about the audibility. So what we are talking about is the difference between audibility and intelligibility. Audibility means that, oh, I can hear it, and the intelligibility, like I can hear it, I can detect sound is there, but it's like having the TV on, but it's not loud enough to understand. There we go. And then intelligibility allows for understanding, and intelligibility is what we need for learning spoken language. Another way to talk about this is, you may recognize this voice. I'll play this. This is where the signal is audible. So it's the Charlie Brown teacher, and so you can tell there that it's speech, that somebody's talking, but we aren't able to understand what is being said. And then here is an intelligible auditory signal.
Welcome to today's parent webinar about auditory neuropathy.
Now here is where auditory neuropathy makes it even more confusing, because someone with auditory neuropathy may have normal detection, but only have audibility because the timing of the signal may be impaired, making speech unclear. With auditory neuropathy, we need to think about normal detection of sounds across all the frequencies, but also determine if the sounds are clear or is the timing normal. And I'm a visual learner, so this is the one way I thought about how the timing may affect understanding. This is a phrase where I change the spacing of the letters and words to demonstrate what it would be like if the timing was off. And we can't really understand what is being said there. And then here, for intelligibility, if the spacing is normal or the timing is normal, it would say, it's time to go. Get your shoes on after you take your bowl to the sink, and remember, grab your lunchbox. So for intelligibility there, we need the consistent detection and a clear signal. So if we have that incoming signal, even if it's in the normal range, if we don't have clarity, it's not going to be understood, regardless of where it's coming in at. All right. So how do we determine if your child has audibility or intelligibility? In combination with audiology, we want to have a speech and language evaluation, and this provides a baseline for future comparisons to know how much progress is being made within a certain time period. So we expect a child to make 6 months of progress in 6 months' time with their language. Our speech and language eval also shows you how to talk, allows you to talk with the speech pathologist about your expectations and communication for your child. So we recommend the evaluations be done for all children with auditory neuropathy after a diagnosis. Even at a few months of age, the speech and language can be assessed to determine if the child's following a normal developmental pattern with their listening and their vocalizations. There's a lot happening within that first year, kind of behind the scenes with listening, that sets the stage for language development. I like to think of it as the duck in the water with its feet underneath that are constantly moving, just like newborns in that first year, they're constantly listening, and there's a lot happening in that brain. Think if they have good detection of sound, your child might hit some of those expected language targets in the first year, such as startling to a sound or turning to voice. But by 9 to 12 months, they need to have more than just that detection of sound. And we don't want to miss out on a year of learning language to find out there's a delay. So the sooner the better. Even for children with auditory neuropathy that have normal speech and language, we recommend interval evaluations to monitor progress. And these evals look at a variety of areas, including articulation, or how a child's speech sounds, their vocabulary, so single words, understanding of language and at the sentence level, how your child uses language, words, or how they put their words together. Also looks at play skills and literacy depending on their age. So this variety lets us see how a child functions in different areas. So for example, can they do really well at the single word level? Like if you say ball, like can they go get the ball? But if you put that into a direction, go find the ball under the chair after you get your shoes on, is that where the breakdown happens when it's more connected speech? So frequently for children with auditory neuropathy, the longer the phrase, the more difficult it can be to comprehend. There's more areas for that timing breakdown to occur. Monitoring the language and listening is our way of following the child's language and knowing if they've progressed in a timely manner or if it's slowed or stopped. So we want to make sure they just stay on track. Given that no two children are the same, our evaluations allow for testing of language to determine if they're in their age range for language or if their chronological age is above what their language age is. So is there a gap or a delay, or if they're meeting their milestones. So if there is a delay, we recommend weekly therapy. And here we do auditory verbal sessions, which are diagnostic in nature, so it allows ongoing assessment of our goals. Also for you to know what to watch for at home and how to implement those goals at home as we have you as parents in our sessions. This also provides an opportunity to collaborate with the child's audiologist on a consistent basis for us to check in with them and provide information about how their progress is going. Here at U of M, we have 4 therapists, speech therapists specializing in listening and spoken language. And for more information, check out our next parent webinar, but also there's great information on the AG Bell website and the Hearing First website. Overall, listening and spoken language specialists work with children who are deaf and hard of hearing and their parents that are seeking listening and spoken language outcomes. Therapy allows us to assess speech production errors and determine if they're able to produce the sound through listening and monitor that development in combination to their age, if it's age appropriate or not. In order for natural sounding speech to develop, your child has to have access to all those sounds, and it has to be a clear signal. So these sessions allow us to learn about your child's auditory behaviors, what they can do through listening alone. Are they using gestures and visuals to decipher the message, or are they able to do it through listening? Your child may be acting out to avoid difficult situations of listening, and Think about it, especially in noisy environments where the listening environment is even more difficult. So just to give another visual here, so what if one day they have poor detection? It might be giving us part of the picture. Or the next day the sound quality is poor, like the timing is off. And then maybe it's changing, from their fluctuations in the hearing. Or it's becoming clearer, but in general we need that clear signal to have a good picture and understanding. If you want more information about language milestones, AG Bell has some handouts for parents which highlight the different ages and stages of language. So under the, I think it's the Teach header on the website, there's a section called Family Resources, and there's a section called Ages and Stages, which is just nice to kind of see what a child should be doing within a certain age. So what we know is there's an impaired auditory system. We know the brain needs a clear signal for learning spoken language. With cochlear implantation, we expect a year's growth within a year's time. And as your child grows, we want his or her language to grow as well. Cochlear implants may improve that timing or the incoming auditory signal, resulting in improved speech recognition. So children with cochlear implants and auditory neuropathy here at U of M perform equivalent to children with sensory neural hearing loss when there are no additional disabilities. Things to watch for. That might be indicators that your child does not have a clear auditory signal, so speech may not be understood by others or strangers. You may be unable to understand your child, but a new listener may say that it sounds like they're speaking a foreign language. Does your child always want to watch your face during communication and use the lip reading for support, kind of telling us that they need more than just the auditory for understanding? They may comprehend single words, but need supports when it's a longer phrase. And their progress may be slower than expected with language. So all children with hearing loss have difficulty listening in noise, but something to think about is your environment. And life is noisy, and it's always going to be that way, but think about if they are struggling or the behavior is acting out more when it is in a noisy restaurant or the gymnasium, and keeping that in mind. Your placement, maybe being close to your child's ear. If it is noisy, that they can also see you to have that lip reading support. If you're at home, think about keeping the laundry room, the door shut, or running the dishwasher at nighttime if possible, so that you can kind of reduce the noise within your own environment. Additional supports, making sure that they are able to see your face when you're talking with them, that the lighting is good. We have a lot of parents that use closed captioning on the television for older children so that they can read what is being said as well as listen. So there are solutions for children with auditory neuropathy to develop listening and spoken language, and therapy can help determine if that progress can be made with their current hearing or if cochlear implantation is recommended. And parenting isn't easy. I think of these appointments as information gathering to help you create what is the best plan for your child. So hopefully we've answered some more questions, but if you have any specific ones, we can take those now.
Thank you, Kelly. Again, for those of you watching a recorded version of this webinar, please send your questions via email to me at oto-soundsupportci@med.umich.edu. Our next webinar is going to be Auditory Verbal Therapy, the Who's, What's, and Why's, presented by two of our speech-language pathologists, Abriz Farhad and Ellen Thomas. I would like to thank Kelly and Caroline for taking the time to present today and for those of you logging on. We look forward to continuing our series this summer, and with that, we will conclude today's webinar. Thank you again for logging on, and I hope everyone has a great day, and we hope to see you at our next webinar.